building these as we go. I'm pretty, I'm in the pathology, but I'm still not finished with the chapter. All right. So I'll be seeing you guys as I progress throughout. We have 2 tests next Wednesday, right?
Again?
Next Wednesday?
Friday.
This test is Friday.
This test is Friday.
Both of them on the same day, huh?
No.
No?
Physics is Wednesday.
What do you mean?
Physics is Wednesday then.
That's good.
Physics is Wednesday then.
Just one at a time.
Okay.
Stupid too much.
Pretty good. Pretty good.
No.
Okay. So this one needs to be on Friday because again, it's a long chapter right here. I'm probably just gonna get to the anatomy, and then just to let you guys digest. Because I really want you guys to read the chapter, to start reading the chapter. What I'm gonna do, guys, I know before I had this class, it was Ms. Shepherd's class, right? And I know she was talking about not wanting you guys to do the outlines. I will actually give you 2 points on your test if you do the outline for this chapter, for the chapters going forward, okay? Because I want to ensure that you guys are reading, and when I say something, it's not your first time hearing it. So, if you want 2 points, please give me a nice outline, a nice summarization of the chapter, and I will apply it. Huh?
Do it before the chapter or before the?
Well, this one, you can't do it before the chapter. We've already started. I just thought about this because, again, with the thyroid grades, I really, with us finishing up early and everything like that, I thought they were going to be a lot better than what they were. So when they weren't, I was like, what can I do to incentivize reading? Okay, that's what I will do. I will let you do the outlines and to incentivize some kind of reading in these chapters we have coming up.
Do you want the outline to be the specific way, or we can do it any way we want?
I don't have any specificity about it, honestly, as long as you're not just giving me the minimum. You know what I mean? Like, don't just give me all the headers and say, oh, here's my outline, without giving me any kind of supporting information.
For small part,
Huh?
just for small part.
This for small parts. This for small parts.
Not for physics, just
Not for physics, just for this class.
Do when?
This one I'm gonna have this one due. We have a test Friday. I'm gonna have this one due on Wednesday. Before that, when we go to the next one, I'll have it due. I'll kind of have the due dates as we go along because I have to see how those lectures are flowing.
So we still can bring the outline first.
Yeah, this one's gonna be due next Wednesday. We have a test Friday, right?
Yeah.
I want the outline for this next Wednesday.
Does this book have a workbook attached to it?
It does. Ms. Shepherd didn't require you guys to buy it though. It will really be helpful if you did use the workbook, but Ms. Shepherd didn't require any of the students to buy it, but it does have one. It does have
Because the
one.
last class, your senior class has a workbook.
They do. Again, that book right there, like I said, I use both of those books, this book and their book, in conjunction to make these lectures. Which is why, like say for instance with the thyroid test, some of those questions I got from the workbook that they used, which is why I left some information off or I didn't, which is why I had to throw away questions today. Because I didn't thoroughly check those questions as far as like line them up to what I taught you versus the question I gave you. But yeah, they do have a workbook for it. So again, outline guys on Wednesday. I'll put that on the board as well. Alright. So, starting this breast unit, real quick, no questions on thyroid, right? We're good on that. Know our most common stuff, guys. That's the most important thing. The test I give you is going to be way more in depth than what's actually going to be on the registry. Because the small parts section of the registry, of course, small parts anatomy is on the same test. That's your small parts section is, I think it's 15%. So it's not a huge chunk. But it can fail you, of course, if you don't know them, but it's not a huge chunk of the test. So that's why I say know the most important things about these subjects. The breast test itself is its own exam. Okay? And of course, I don't do breasts at all. I've probably done 10 breasts in my whole career. So bear with me. I'm gonna do my best to teach you guys what I know, and I'm taking in consideration, I'm talking in technology and stuff like that. Because I don't do breasts all the time, but I'll teach you the most important things about it. So, breast. And that is a mammogram, guys. For those that don't know, that is not a breast ultrasound. That is a mammogram. So, breast, guys. I'm wearing magenta. It's the closest thing I have to pink. I'm wearing magenta today because pink, of course, is the for breast cancer. You know, and when we started this new unit, I wanted to wear the color accordingly. All right. So, breast, guys, this is not in your textbook right here. This is just an information I got because breast ultrasound is useful in breast cancer screening. Okay. So, breast, guys, are real common. When we're talking about breast cancer, 1 out of every 8 women will develop breast cancer, guys. That's a huge, tremendous amount of women. 12.5% of the population getting breast cancer, right? There's a lot of people that are diagnosed with breast cancer. It is the most common type of cancer among women in the entire United States. Okay. It is also the second leading cause of cancer death among women because of how quickly breast cancer can spread throughout the body. Okay. It is estimated the lifetime risk of breast cancer development is approximately 12% or 12.5%. Okay. That is 1 out of 8 women will develop breast cancer in their lifetime. That's not to eliminate us guys, because guys do get breast cancer as well. Guys can get breast cancer as well. And breast cancer is probably the most, I don't know, what's another word? I don't have for lack of a better word, not celebrated, but it's the most popular cancer or the most recognized cancer, I'm trying to say, that, you know, we acknowledge, the most acknowledged cancer, I would say. Okay? So, for example, one of my big sisters, one of her best friends, she had breast cancer when she was 23 years old and had to get a bilateral mastectomy. Clearly, I'm not up on my Dr. Body or Dr. Miami, whatever he's doing out there. Okay? So yeah, she had to get a double mastectomy at that young age, you know, and then the cancer came back, and you know, they had to go in even further, and she ended up passing away when she was 30 years old. Wow. So deadly cancer. All right. Early detection of breast cancer is important because cancer is difficult to detect, but it's also difficult to get rid of once it is spread. Of course, we know that, right? Once cancer is spread, it's tough to you know, narrow it down and try to get all these lesions and cancer lesions and nodules throughout the body. So it's really important that you detect breast cancer at an early age. Okay, I'm sorry, early in the stage of breast cancer. It's really important. Sorry about that, I got music on my phone. I can read your mind. All right. So breast sonography is useful. Is a useful complement to physical examination, mammography, and MRI in the assessment of breast disease. Okay. Well, breast ultrasound, I wouldn't say it's the most reliable, right? The gold standard for imaging breast would be MRI. Okay, that would be the gold standard. But we know MRIs can be very, very expensive. So they use mammography in conjunction with breast ultrasound in the early detection of breast because it's less expensive and it still has the ability to detect lesions or masses. Okay. Mammography is a primary screening tool. Aside from the physical examination, hope everybody does it in the shower. When you're in your shower, you know, we all know how to do a physical examination on ourselves, feel it for lumps and nodules and masses within the breast. Okay. Mammography is a screening tool. It's the most common imaging modality used to evaluate the breast. Okay. It detects suspicious patterns of microcalcifications, and it cannot detect all breast masses. So, for instance, you have really thick, dense breast. The X-rays, X-ray photons will not be able to penetrate that dense breast tissue. Okay, which is why it's not useful for all breasts. Okay, you have really pliable breast tissue, then ultrasound will be useful in detecting that. Okay. 3D mammograms or tomosynthesis is able to detect the breast layer by layer. There are 3 layers to the breast. Okay, so with the 3D tomosynthesis, is able to see every layer of the breast. Okay, 3D mammography. Okay. Mammography, the reason you have to use it in conjunction with another type of exam is because mammography deals with a lot of false positives. right? Pat, aren't you a mammo tech too? Pat, you look just like all-star. My goodness. MVP. And it deals with a lot of false positives, meaning that, they get suspicious of something that's really not there. Same thing with ultrasound. Ultrasound can see the most minuscule things, but ultrasound also misses a lot of things because sometimes it's not able to differentiate between those tissue unless it's a big impedance difference, right? If the mass is similar to what the density of breast tissue, then that impedance difference is the same, and the ultrasound won't be able to detect it, which is why MRI is the gold standard, because MRI has that sensitivity for looking at soft tissue structures. And these are just more images of breast mammograms. What position is this, Pat? CC?
Cardiac coronal view. Cardiac coronal view.
Cardiac coronal view. Profile of the breast.
Left review.
Mm-hmm.
Left review.
Is it left or right?
Left review.
Left
review.
Pat, is it left lateral?
That is a,
2 and 3 left review.
what do you say, lateral view? 2 and 3, you saying so like a lateral view. The patient is like, they're trying to get more axillary breast tissue. So they're kind of leaning the patient in a little bit, so they want more of a lateral view.
Okay.
But there's a 30-degree.
Educators. I'm gonna lean on my breast technicians in here, my breast technologists who have rotated through breast. Us guys, me, Dewey, and Sophie, we only been through there to get our comp. But that's what a mammogram looks like right there, guys. So the clinical role in breast ultrasound would be for sonography. It is able, of course, just like anything else, it's able to differentiate between cystic masses and solid lesions. Okay, that's the number one thing. Able to differentiate between those two things. Okay, cystic lesion will of course be more hypoechoic, correct? A solid lesion would be hyperechoic, or it could be of mixed echogenicity. All right. Breast ultrasound uses non-ionizing radiation, meaning that it won't cause harm to the body. It won't cause harm to those breast tissues. Because you don't have any radiation going on with ultrasound. But again, that's not to say ultrasound doesn't have harmful effects, right? Because as I taught you in the intro, ultrasound is still such a young modality that we haven't seen the lifelong effects of ultrasound over a longer enough period of time. Ultrasound also examines the patient with minimal pain compression. You ladies know when you go get your mammograms, they put you in that machine, wham, they slam your breast in that machine, right? It looks painful when I see them. But with ultrasound, you don't have to deal with those painful compressions, and you're able to do patients that have a whole host of conditions, like if they have an abscess, if it's really sensitive, if they have any kind of breast trauma, we're still able to image that breast or those breasts. Okay. This reminds me of a time I was on call one time. Again, I can remember every single breast I've done because there's usually something wrong with them when I have to do them. So I got called out to do a breast one time. And have you guys been to breast yet? Anybody? Nobody? You haven't been to breast yet? When? Have you seen an abscess up there yet? Okay. You saw that been taught. Okay. So I get called out to do this breast, and this lady has an abscess. So before you know it's an abscess, you can just see it's super red, it's swollen. Of course she didn't want me to do it. She asked for a lady, "Man, I'm on call. You want to wait till tomorrow, somebody else be here, then we can do that. If not, let's do it. I'm ready." So we do the breast. You can see it's just a big complex collection of something, and it had like a how I don't know, you get a pimple that has the head on it, right? Mm-hmm. And I can see the head of the abscess on the breast. So I'm scanning the breast. I didn't realize how sensitive that breast was. I literally just put the gel on it. It was almost like the heat from the gel caused this abscess to burst. This abscess comes out just all this yellow and green stuff, and it's just like a river. It's just flowing like really, really bad. Oh my God, the worst smell I ever smelled. the worst smell I ever. That's why I had to hesitate for a second. I almost came back to me. Yeah, it was really bad. So that's my experience with.
What did she do?
Huh?
What did the lady do?
She was
Screaming.
She was in pain, Lauren. She was not feeling good. But
It might have relieved her.
Huh?
I said it might have relieved her.
Yeah.
Man, she was in a lot of pain. Even the doctor came in. The doctor came in